Hi, I'd like to introduce to you now a very good friend of ours at Dentistry Today. This is Dr. John West, who I'm sure you have read his articles in our publication. You've seen his courses, seen his presentations. If you haven't, now is your chance to learn. Dr. West, thanks for joining us today.
Thank you, Allie.
It's great to have you here. I don't know if your ears were ringing yesterday at Zero World. We had the panel.
Yep.
And I heard that you were backstage on the first night of the meeting doing diagrams and developing new endo products. I mean, are you always on? Is that how this works?
Not always on. I just have a one-track mind. You know, endodontics is perfect for me because it's a single world and a single situation, a single tunnel, but we're having to grow it into the world of dentistry as well. And this has been a great meeting to integrate both endodontics and restorative dentistry.
You are doing a couple of breakout sessions.
Right.
Tell us about your topics.
I have 3 breakout sessions called the Practice Transforming Magic of Pro Taper Gold. We also have 3 breakout sessions on Wave 1 Gold. So first of all, the theme of my piece was it's not about the tool, it's about the operator. The greatest variable in all that we're doing, even though I'm calling it Practice Transforming Magic, is us, the operator. The reason it's transforming to me as a clinician is because we have a metal now, a metallurgy, that allows us to safely prepare root canal systems without that fear of breaking a file, that kind of thing. So in a nutshell, the word, I think, is confidence. And easy is important, predictable is important, but when we go into a procedure, whether it's endodontics or anything else, if we don't have that level of confidence, it's scary and it's not fun. And dentistry is supposed to be a lot of fun. So if you want me to talk a little bit about the details of that presentation.
Sure, we'd love to hear more.
We discussed the access, of course, and how to make a successful access cavity, because no instrument is of any value if you can't find the root canal system.
This is true.
So that's where it started. And I also started with endodontics has come out of the dark ages that we've begin to see now that we couldn't see before. The thing that's unique about endodontics is we're blindfolded. It's the only aspect in dentistry where we do it in the dark, basically. And that's pretty scary. You as a restorative dentist can imagine doing restorative dentistry with your eyes closed. You couldn't do it, you wouldn't do it.
Right.
So I identified in my opening presentation 6 ways that the lights have come on. One was the microscope, and that's allowed us to see entrances and root canal system. Another is digital, so now instead of looking at a little x-ray, it's big enough that you could see it. Another would be the apex locator. We know where the end of the canal starts and stops. That those tools were not really sophisticated in the past. The golden technologies, and it's which I talked a little bit about, and I'll talk a bit more if you want, Allie. And also the CBCT, the ability to see teeth in 3 dimensions and spin them around. And then the last aspect I mentioned as far as being able to see inside teeth now is the Tooth Atlas, which if you simply Google Tooth Atlas, you can order this software that allows you to literally go inside teeth and examine teeth. For example, if you're treating on Monday a patient with a maxillary lateral and you look at all these Tooth Atlas teeth, which are real micro CT scans of real teeth, you'll notice something very interesting. Every lateral has a little hook at the end. And then you say, I need to deal with that. I can't just pretend it's this long, it's actually have to make the curve. So that changes how you approach it and how you think about it and how you do it.
So you have to know what you're dealing with.
Yeah, because you can see everything else in dentistry, you know what you're dealing with. You're looking right at it. I'm looking at you now, but I can't see inside your brain.
Right.
And we're asking to be able to see inside the teeth. And that's a big, tall question, which we're answering. And technologies in the very near future, because change is happening, technologies are improving, not linearly, but exponentially. So we're at the knee of the curve of being able to truly see in root canal systems and communicate both the software and the 3-dimensional imaging to actually be able to map the inside of the root canal system even before we see the patient or treat the patient.
Wow.
So that's huge. Back to the breakout sessions, just a quick summary there is I mentioned the access cavity, and there's no, now we're doing root canals, Allie, so pay attention. But you need to have a glide path, which is a word we made up, which is a smooth tunnel from the top to the bottom. That allows rotary and reciprocation instruments of any kind to follow safely. And then, at least in the Pro Taper, I talked about how to use them. There's a specific sequence, purple, white, yellow, red, and you always follow that sequence. That makes it simple. And then I demonstrated the value of how you use them. And the shapers, you use very specifically. We brush, and then we follow, brush, and follow to length. And the finisher is just the reverse. You follow and brush to length. When are you finished shaping? How do you know? When are you done with your crown prep? Well, you look, and in endodontics, you look at the file. And if the file is cutting dentin in the apical flutes, that means that shape exists. Your final validation is that the cone fits. When do you seat the crown? You seat the crown when the crown fits. When do you finish the endo? When the cone fits. And so that was it as far as the technique goes. I mean, an hour is not very long, and there's more to come. And I also, on the website, not the website, but on the downloads, there, I think I left 7 articles, gave 7 articles that they can refer to, maybe 8, on access, glide path, find, follow, and finish. And so that for more resources to read later on.
The 3 Fs, yes, in
Yes, the
dentistry
3 Fs.
today. Definitely check that one out. So how has it been here for you at Cero World? What has been your experience here? It seems like Dentsply Sirona is really on the cutting edge with endo right now. Did you find that to be true?
As an outsider looking in, what I observed is you have a 500-pound elephant joined another 500-pound elephant, and now you have somebody who really has the opportunity to positively influence dentistry from a comprehensive point of view, from an interdisciplinary point of view, not just the specifics of CIRAC and Pro Taper or Wave 1 or Gutta Percha or anything like that, but rather integrating all these. And the word that I really heard coming true was single patient treatment, single this, single that. And I guess that's what the consumer wants. They pull up their phone, they want instant this and instant movies, and
That's true.
And the culture has completely changed. And what I love about their relationship, Dentsply and Sirona, is that they are not, they're responding to the change, but they're also creating the change.
Yes.
And as a dentist, that's a positive thing, because when we can find out what patients want and we can deliver, that's terrific, because everybody wants to have a great smile. There's nobody that doesn't want a great smile. And everybody's capable of having it. And now we have the methods, the tools, and techniques and technology to achieve that. And endodontics, of course, is just a part of it. But the thing about endodontics is it can be the weakest link, but it can also be as strong a link as any other part of dentistry.
Well, that's great. Thank you so much. I wish we had even more time to talk, but I think we have to cut it short now. But thank you for joining us today. And always look for Dr. West in our magazine. Look for him at meetings. You will surely benefit from his expertise. Thanks for joining us today.
Thanks, Allie. My privilege.